Imagine a world where data collection and analysis can easily be harnessed to solve the world's most pressing healthcare problems. The University of Arizona Health Sciences is seeking to create that world by opening new frontiers for better health, a strategic initiative to create new pathways to discovery and improve health and well-being for all. Alongside efforts to develop new healthcare technologies and expand research and training resources, one of the largest endeavors in this initiative is a collaboration among experts across the University of Arizona to make Arizona Health Sciences a health analytics powerhouse.
The Health Analytics Powerhouse is primarily designed to make it easy for our researchers to be good data stewards. And by that, what I mean is bring data that has identifiable information, needs to be handled securely, at the same time continue their collaboration. We are putting together infrastructure that would allow our researchers to do that. At the same time, there is analysis that needs to be performed with these systems and data, and all the tools and methods that are needed require a lot of training, and we are going to bring that training to our researchers as well.
One way the university is improving its data infrastructure is with the development of the Data Analysis Enclave, a protected system that allows researchers campus-wide to collaborate and share data.
The fundamental problem that we are trying to solve is how do you bring in data that is requiring higher level of security and privacy handling, and then analyze that as a team. Some of these things are tremendously complex.
To bridge knowledge gaps in this evolving area of data analytics, Arizona Health Sciences funded a data science fellowship program that pairs researchers who need expertise in this field with postdoctoral fellows who have strong data skills.
At the same time, we are working with the university libraries and also other data science providers on campus to create series of learning events around topics that matter to researchers. Any paper that you publish, you want that data and the analysis to be reproducible and accessible to others, and we are providing the tools and the systems to make that happen.
A real-world example of this improved data collection and analysis is the Arizona Cohort study. Led by the University of Arizona Health Sciences, this survey-based longitudinal study is designed to follow a cohort of up to 10,000 people for 2 years to collect accurate data about COVID cases and answer some of the biggest questions emerging from this novel virus.
The Arizona Cohort study started really as kind of the brainchild of several epidemiologists in our department. Very early on in the pandemic, we all started reaching out to each other. We were at the precipice of something very big and wanted to make sure that we were there early on to start collecting that information and doing it as prospectively as possible.
This reinforces the need for data security when it comes to healthcare information. AZ Cohort established their survey in a HIPAA-compliant data system that sits behind several university firewalls and is specifically designed for clinical research.
We're asking people about whether or not they've been infected with a virus. We're asking them about their chronic health conditions. We're asking them about symptoms. And so we want to make sure that we're respecting people's information and keeping it as secure as we possibly can.
AZ Cohort also demonstrates the importance of being able to securely share data among teams for ongoing analysis.
Epidemiologists, they do a lot of their own statistics, but once it gets more complex, you need an expert. And so that's why they involved me. Data are the foundation of research, but you have to be able to interpret that data and in meaningful ways. I work to create the story behind what the data are trying to tell us.
COVID brought to the forefront the importance of accurate and secure data collection for the general public. But for the University of Arizona Health Sciences, it's just one example of how health-related research can excel through a focus on advancing infrastructure and technologies. This is just the beginning of new frontiers for better health.
My hope is that every student, every faculty on our campus is never intimidated by the size and scale of data, and they can ask questions that are grand, they're large, but more importantly, build the solution, because asking the question is one thing, solving it or answering it is another, And to do that, it takes a community, it takes a team.